Danny Bond was born with a terrible bowel disease and had been in and out of the hospital all his life. By 13 years old, Danny had started to talk about committing suicide because the pain had become overwhelming every day. He attempted suicide 3 times, and 3 times his mom had to resuscitate him and called an ambulance. He ended up starving himself and asked his parents to stand by and make sure no one would help him. This was the only option Danny had. Voluntary euthanasia is conducted with the consent of the patient and physician and is carried out with the assistance of the physician. This is the option I believe needs to be available to any and all terminal ill patients. Voluntary euthanasia is very different from suicide. The patient is choosing to end their pain and suffering, which they suffer from an already incurable disease. I believe voluntary euthanasia should be legal in all our states for 4 main reasons. First and foremost, I believe it's the patient's right to choose how they want to live and die when suffering from a terminal disease. We as bystanders do not have the right to tell someone that they should continue to suffer in pain and live their life in such horrible state. How is one to live a good life when they are in constant pain? Imagine yourself or someone you love laying on the hospital bed in persistent pain with a disease that is slowly killing them in a horrific way and having no option other than to sit and wait to die. Second, why should voluntary euthanasia be mandated by what the government sees necessary? These laws that prevent voluntary euthanasia can prolong a patient's life that is only full of pain and suffering. Now I understand there needs to be laws and guidelines in places to fully conduct voluntary euthanasia, which I will get to later in my speech. But who better to decide than the people who are in the front lines of this highly debated topic? Thirdly, our healthcare system could benefit immensely if this were to become legal. In 2009, Medicare paid $55 billion just for doctor and hospital bills during the last 2 months of a patient's life. Imagine how our healthcare system could benefit if some of this money was available for other medical needs. It costs $35 to $45 for the medicine needed for voluntary euthanasia. I believe out of these terminally ill patients, some would have chosen voluntary euthanasia for relief of their pain, not for monetary reasons. Another medical benefit would be organ donation. Patients choosing voluntary euthanasia would have the option to donate their organs upon their death. Not only would this save the lives of many, it would benefit the patient's life. Right now in the U.S., there are approximately 125,000 people waiting for life-saving organ transplants. Families left behind would benefit greatly from this. Those are 3 of my main points explaining why I believe voluntary euthanasia should be legal. Now let's take a look at the states that have already legalized voluntary euthanasia. There are only 4 of them: Oregon, Vermont, Washington, and Montana. I believe these states have the proper rules and guidelines in place to conduct voluntary euthanasia. The eligibility requirements are as follows. For Oregon, Washington, and Vermont, the patient must be current resident of the select state, a minimum age of 18, have 6 months or less to live, and have 2 oral requests at least 15 days apart and 1 written request given to the physician requesting voluntary euthanasia. Montana currently has no laws in place except the patient must be a resident of that state. Montana is expected to follow the other 3 states' eligibility requirements very soon. Only 4 states have chosen that the patient's right to die peacefully should be up to the patient. If you remember the news within the past year about a California resident named Brittany Maynard. Brittany was 29 years old when she was diagnosed with brain cancer. Her life took a dramatic turn and was revolved around hospital stays, doctor consultations, and medical research. She immediately had 2 surgeries to stop the growth of her tumor. 6 months after the surgery, the tumor grew back and was more aggressive. She then had a different option available to her. The doctors prescribed her full brain radiation. After she read about the side effects, and realized her quality of life would be gone, Brittany and her family came to the conclusion there was no treatment that would save her life, and the recommended treatments would destroy the time she had left. She considered passing away in a hospice in San Francisco, but even with palliative medication, could develop potentially morphine-resistant pain. Her and her family decided death with dignity was the best option. Since California does not allow voluntary euthanasia, her family and her decided to move everything to Oregon and become a resident of the state. It was there that they spent valuable time doing everything required to become a resident, like obtaining a driver's license and finding new physicians. Once she was considered a resident, she was able to get the medicine prescribed for her so she could die with dignity. She died November 1st of 2014. This is what she had to say about voluntary euthanasia. Now that I've had prescription filled and it's in my possession, I've experienced a tremendous sense of relief. And if I decide to change my mind about taking medication, I will not take it. Having this choice at the end of my life has become incredibly important. It has given me the sense of peace during the tumultuous time that otherwise would be dominated by fear, uncertainty, and pain. As you have all heard today, voluntary euthanasia is something that needs to be readdressed, and from a standpoint of the patients, not from our personal moral boundaries. We as society cannot pretend to understand the unnecessary suffering and constant pain these people go through every day. Now I urge you to visit these dying people and hear what they have to say. Be part of the resolution of their life, not part of the current blockade in front of them. Give them a choice.